I am Dr. Ashutosh Gupta, and I had the good fortune and the God-given message to donate a kidney in 2019 to a dialysis patient. Chronic kidney disease is associated with progressive and irreversible loss of kidney function and finally resulting in end-stage renal disease requiring either dialysis or getting a kidney transplant. Chronic kidney disease, or briefed as CKD, is a very common problem affecting about 1 in 7 US population, roughly about 15%. It is more common after the age of 65, affecting almost 34% of the population. Diabetes and high blood pressure remain predominant risk factors for chronic kidney disease, and it is also the 8th leading cause of death in US. According to the American Kidney Fund data, about 815,000 patients live with end-stage renal disease, out of which about 260,000 people are on dialysis and about 260,000 people are on kidney transplant. Patients with kidney transplant certainly have a better quality of life and about 50% less mortality than dialysis patients. Overall, about 1/3 of the transplant come from living donors and the remaining 2/3 come from deceased donors. There are about 90,000 patients who are waiting for the kidney transplant with an average waiting time of about 3 to 5 years after they have been registered. About 11 patients die every day because they don't get a kidney transplant. More availability of the live donors will reduce the waiting time for transplants. Let me address a few common questions about live kidney donation. People ask, is it safe to donate a kidney? My answer is very simple. Yes, it is absolutely safe to donate a kidney. Many people are born with one kidney and they have a normal life. After kidney donation, the life insurance companies do not raise their premiums, indicating no higher risk or longevity issues. Prior to donating a kidney, a potential donor is extensively evaluated not only for his or her eligibility to donate a kidney, but also for the safety of the procedure. There is always a small risk for surgery, and in a recent study, about 30 years of living donation, 1 in 10,000 patients died within 3 months of surgery. Another common question is, can a donor live a normal life after kidney donation? Again, the answer is yes. The donor can live a normal life but has to be careful. The donor should avoid sports which involve abdominal injury and must have a regular checkup. Specifically, the donor must have a good blood pressure control and may require some degree of dietary as well as lifestyle modifications. Another common question, up to what age can one donate a kidney? Usually up to 70 years of age, and the oldest kidney donor is 84 years of age in 2019. Another question, what are the chances of developing a kidney failure after kidney donation? The risk of developing kidney failure after kidney donation is 0.1 to 1.0%, average or mean about 0.5% after 15 to 20 years of kidney donation. If someone donates a kidney, say at the age of 65 to 70 years of age, there is a 99.5% chance that the person will live a healthy life until the age of 85 to 90. If a kidney donor unfortunately does develop kidney failure, ESRD, he or she gets a high priority on deceased donor waiting list. Let me briefly mention about my own example. I donated a kidney at the age of 71 years and 10 months. Although I was above the cutoff limit of 70, but fortunately I was healthy enough to be able to be evaluated for being a potential kidney donor and was found to be eligible. Prior to the donation, I had to change my dietary habits and give up all my favorite salty snacks and pickles, etc. for the blood pressure control only on one single medicine. I underwent a very extensive medical evaluation, including a psychological checkup also. There was a small risk for any surgical procedure, but I was ready for it. Above all, I also had the blessings from my two spiritual swamis that our family has been very close to. One was Swami Brahmarupananji of Vedanta Center in Washington DC, and Swami Ishatmananji from Vedanta Center in Chicago. And finally, I could not have done this without an unconditional support from my family. My recommendations are that you have to have a mindset and willingness to donate. You should be willing to undergo lots of testing to determine your eligibility and safety. But once you decide to donate, it really doesn't matter whether the kidney goes to your friend or to a relative or to a patient or to an unknown person. It will save someone's life. And do not worry how the kidney will function in the recipient. You have done your job with good faith and good intentions. And finally, I would like to quote Lord Krishna's message from the Bhagavad Gita, chapter 2, verse 47, which says, Karmanyavadikaraste ma phaleshu kadachan ma karam phalhetur bhurma ma te sangatsva akarmani, which translates into, to work alone you have the right and never to the fruits of the work. Don't be impelled by the fruits of work. At the same time, do not be tempted to withdraw from work. Thank you very much.